means that we truly have a worldwide audience. So how's everybody doing this Sunday night? Hope you guys are hanging in there. Hope everything is going well in your homes and in your families. It has been, again, another challenging time, I think, for so many of us, because we simply continue to deal with COVID-19 around the world. Now, if you're here in the United States, we know that many parts of the US, especially the South and the West, are undergoing a second surge, meaning they're seeing higher cases of COVID than they've seen in a while. Florida, if you watch the news today, reporting the highest number of new cases since the start of this whole thing, even higher than what New York was dealing with before. I got a hello from California. Hi from California. For everybody joining me anywhere else, give us a shout out. Let us know where you're from. It's so great to bring this community together. We've got people from all over the world and even from all over the United States. So welcome to Sunday Night Live with me. I'm Dr. Taz, if you don't know me already. And you know, if you've been coming to these Facebook Lives and lives every Sunday night, that we like to start with a quote. And I think it's a great way to move us into everything we're going to tackle in just a second. Hello, Holly from Nashville. I love seeing these names and faces that I don't get to see on a regular basis. We got somebody from Florida. We want you to maybe tell us at some point. I might be calling on you in just a minute to tell us how things really are there in Florida, because the headlines look pretty bad. All right, let's start with a quote. You guys ready? All right, worrying does not take away tomorrow's troubles. It takes away today's peace. And I think that is the theme of 2020, where many of us have been worried about so many different things when it comes to this pandemic, when it came to the race wars, a lot of uncertainty about our future, a lot of hesitation about what we're going to go through and what the fall is going to look like. I think a lot of us were in the spring and we were hoping, let's get through the spring. And if we can just get through the spring, it'll all be over. We'll get our summer back and our kids will be back in school in the fall. Life will get back to normal. But as we have seen, it's far from the case. We have many places getting very close to going back to shelter in place, back to a shutdown. How do you guys in Florida feel about that? I know that they're thinking about this in Florida. I've heard rumors that they're thinking about this here in Atlanta as well. So that's on the table. I know in California, for those of you out there, I know Governor Newsom has shut down many counties that are having a spike in cases. So what's going on here, guys? How do we tackle all of this? What do we do? I'm going to give you my 2 cents, and then we're going to look at the research and the data so we can really get some hard numbers. But here's what I think is happening. I think that we now do have testing. We have reopened. We have had protests. We've all been mingling and congregating. If you're here in the South, you know that people have been going to restaurants. They've been doing everything kind of like they normally do, quite honestly. And I think that I expected, and many of us expected, the caseload to go up. So I expect that. I don't think you guys should have a lot of fear if that's what you're seeing in the news. Now, what we really want to pay more attention to is the how kind of aggressive is the virus. And what we're hearing and seeing is that it isn't as aggressive as what we saw in the spring. Now, is that because we know how to treat it better, or is that simply because the virus has weakened? We're seeing reports in the literature of both of those things, that we think the virus may have weakened over time, so it is more transmissible, meaning it can spread more person to person, but it looks like it's not quite as sort of devastating as it was the first go around. It's sort of what I'm seeing in practice. We're hearing about people being COVID positive, having COVID positive 19 symptoms, but then really getting over it in about a day or two. So things are shifting and changing as they always are. So what do we do with this particular illness and situation? We're going to go through a step-by-step plan in just a moment. And I brought with me my immune bag to hopefully help all of you guys understand how to take care of your immune system. Because I think, as I've been saying over and over again, at the end of the day, I think that's what is going to matter. I think that's where our energy really needs to go. All right, let's break down the stories first. Let's jump right into it. The number one debate happening right now is, should our kids go back to school? What do you guys say? Yes? No? What do you think? Well, here's where I am, and here's where the AAP is, the American Academy of Pediatrics, and the CDC. Almost everybody unanimously agrees that children need to go back to school. The best learning happens in school. Best learning is social emotional. For many kids, it's not just about learning, it's almost their second home, and they need the community. And then for another group of kids, it's issues like safety and violence and protection from all of those things, and food scarcity. All of those are issues. Now, The AAP has issued a statement multiple times in the last few weeks. Here's the last statement. With the above principles in mind, the AAP strongly advocates that all policy considerations for the coming school year should start with the goal of having children physically present in school. All right, so that's the AAP really advocating for kids to be back in school. At the same time, I think just this Friday, I think it was Friday or Thursday, there was a commentary in pediatrics that children don't transmit COVID-19. Schools should reopen in the fall. And this was published in the Journal of Pediatrics, which you know is the official journal for the American Academy of Pediatrics. And the authors basically commented on the child is not to blame. What is happening as these children are staying home, and what does the data really say, which is what you're not hearing in the news. What's the data saying about children and school? And so I want to read some of this to you because this is what's getting left out when we listen to the news. We are not hearing these statistics. It is ticking me off that we're not getting the full story. But anyhow, here's these are just the facts. I'm going to read. I know you don't want to listen to me read, but that's probably not a better way to do that. In the new pediatric study, a faculty member at University of Geneva's medical school and her colleagues studied the households of 39 Swiss children infected with COVID-19. Contact tracing revealed that only 3, which was 8%, was a child in the suspected index case with symptom onset preceding illness in the adult contacts, meaning the adults had it first. In a recent study in China, contact tracing demonstrated that of the 68 children with COVID-19 admitted to the hospital from January 20th to February 27th, 96% of them, these are 96% of those children, those 68 children, were household contacts of previously infected adults. So again, it's adult to kid transmission, not kid to kid, and not adult to adult. So that's where people are getting really tripped up, and that's where we're hearing the fear and from teachers, and we're hearing the fear in the media, but we're not getting this data. In a French study, a boy with COVID-19 exposed over 80 classmates, guys, at 3 different schools to the disease. None of them contracted it. Transmission of other respiratory diseases, including influenza, however, was very common in the school setting. We don't shut down for the flu. Why are we shutting down for COVID? Please help me understand this. In a study in New South Wales, 9 infected students and 9 staff across 15 schools exposed a total of 735 students and 128 staff to COVID-19. Only 2 secondary infections resulted, 1 transmitted from adult to child. Again, I could read on and on. You guys can take a look at this yourself. This is in the Journal of Pediatrics, released this Friday, July 10th, talking about the fact that it's very difficult to transmit COVID kid to kid or kid to adult. It's adult to adult, the big congregations of adults. That is the primary way that this disease is transmitted. We don't shut down for the flu. I don't know why we're not shutting down or why we're insisting on shutting down for COVID-19. Now, with the caveat, if you're in a community that's seeing a spike, the AAP also acknowledges that, right? The American Academy of Pediatrics does say if you're in a community with a big spike, then you've got to take the right precautions there. That may mean a period, a week or a week and a half or 2 weeks, where you may have to have kids stay home from school. Or if you have a child with multiple issues, multiple diseases, multiple conditions, well, they need a different approach. It's not a one size fits all, which medicine never is a one size fits all. So we've got to evaluate some of these situations case by case, community by community, school by school to understand what the right things are to do. I do think kids and schools have to be more cautious. Children do have to learn to wash their hands. They will have to wear masks. They will have to observe some of these basic social distancing precautions, at least in the fall, until we get this thing under control. So those are things that I think need to happen. But shutting down our schools, watching our kids online learn nothing, and doesn't matter where you're from, whether you're in an elite school and paying buttloads of private school tuition for virtual learning where your kids are checking out, or you're in a different neighborhood where you don't have access to virtual learning and the resources and the tools are so limited, it is a lose-lose for our children. It's an absolute lose-lose. So all of us should be united in the attempts to get our children back in school. So those are 2 statements from the AAP, 1 from the CDC, and it's just so important to be thinking about that. Now, speaking of COVID-19, let's flip to who's really getting sick. What are the issues? And I've talked about this before. I posted on Instagram. I was kind of fired up yesterday and super annoyed with what I was seeing in the literature and in the media. But what and who are getting sick? Well, here are the facts. The facts are that most people having complications of COVID-19 have one or two other comorbid conditions. In addition to that, it is a fact that many people, one of the big risk factors for complications with COVID-19 is obesity. So having more weight on you, which is a US issue, right? So it's not surprising there. Just released again is a study from Wuhan that shows in patients with COVID-19 with or without a previous diagnosis of diabetes, high blood sugar is associated with more than double, listen to that, guys, more than double the death risk compared to others, and an increase of severe publications. Again, this was published in the journal, it's a diabetes journal. It was released July 10th, and it's talking about the connection between high blood sugar levels and complications of COVID-19. Now, that's not surprising to somebody like me who works in this stuff all the time, but we know high blood sugar triggers inflammation. And we know inflammation puts an incredible burden on the immune system and makes it difficult to fight infection. So again, I'm not surprised at all, but it's just a call again, especially where there's obesity, where there's overweight, where there's a lot of belly weight. These are all signs that blood sugar levels are higher than where they need to be. Insulin levels are higher than where they need to be. As the study's saying, you may not necessarily be diabetic, but you may be at risk for having a lot more inflammation and therefore not having a great response to fight off this particular virus. What does that mean for you? It means no matter where you are in your health journey, your diet, what you eat, how you live, your stress, all of that ultimately matters in how you fight infection and how you take care of your immune system. And we've talked about that before, but we'll continue to talk about it through this whole ordeal because I think it's so important for everyone to hear this message and to understand the connection between their diet, their nutrition, their blood sugar, inflammation, insulin, belly weight, and COVID-19. It is all related. It's all connected. And those are the stories that you're not hearing. And those are the stories that we need to tell. All right. So that is what's happening with blood sugar levels. This one is a little bit more concerning. I almost didn't want to share it, but I do think, in honesty and trying to be transparent, we need to share everything good or bad, right? This is talking about one of the first few cases, also released this Friday, where there was actually intrauterine transfer of COVID-19, where a mother that was pregnant and had COVID-19 did pass it to her fetus. So in utero transmission of COVID-19 from an infected mother to her infant. This is one of the earlier cases now that we're finding. And the infants don't have any complications. They don't have respiratory illness or any of those type of things, but there is actually positive diagnoses there. So that's interesting because the other thing we're noticing is directly connected to this next study, talking about how many of us, probably myself too, we may be COVID positive, but we have zero symptoms. We're asymptomatic carriers. In fact, I was talking to friends recently this weekend who have a family member who is COVID positive, and then they went and got the rest of the family tested. And again, some of the family members were COVID positive, but had zero symptoms. So it's taking up to 7 to 10 days to really show symptoms, or some people, because their immune system is where it needs to be, don't have symptoms at all. So keep that in mind, that you could be an asymptomatic carrier, or you may be exposed to somebody who's an asymptomatic carrier. That's why hand washing, that's why masks, that's why rest, that's why all of that matters. But shutting down and quarantining is not the answer. Really guarding and safeguarding your immune system is. And we're going to talk about immune support in just a moment as well. All right. A lot of our healthcare workers may be positive. That's the next study that it's showing right here. And that's not surprising. I think it's out there in the community. I think the goal right now is not whether you are or not positive. The goal is how are you taking care of yourself so that if you do get this particular virus, you are able to fight it off quickly and efficiently. And just a reminder, on the Dr. Taz site, on drtaz.com, we've got all these guides on here. Hopefully you guys have been printing off my guides. I've been putting lots of time and energy to them, and they are a free resource to help you understand your health and to help you journey back to yourself. So there's a guide for women, for men, for helping you understand how to lose weight. And there's definitely a guide, 2 guides for COVID-19 and a guide for helping you support your immune system. So please take a look at all of those resources. All right. Asymptomatic carriers make this virus very frightening. Absolutely. but it's not about being frightened. It's about protecting your immune system and making sure that you, when you get exposed, it's no longer if you're going to get exposed to the virus. I think we need to change the way we think about it. It's not if you get exposed, it's you will get exposed, but what are you going to do to take care of your immune system? How are you going to protect it from it turning into a full-blown attack? This disease, this virus, I've seen firsthand, is even milder than the flu or a cold, but can be as severe as a ventilation in the ICU. What's the difference? Your health, your immune system, and what you're doing to take care of yourself. So let's go. That's a great segue right into this next issue. So I brought a bag, right? A little Flower Child bag. We ate dinner there earlier. But I dumped in here some of my favorite things to help protect your immune system. So let's run through this real fast. This is a product for children. I'm getting asked a lot of questions on what I like to give children. So this is a product called Ion Biome. It upregulates something called glutathione. Glutathione is an antioxidant that helps us all sort of power up and fight off infection, but more importantly, protect the gut and the gut lining. So whether you're an adult or a child, this is helpful. You can take a tablespoon a day if you're an adult. For your kids, you can do 1 to 2 teaspoons daily. If they start to look or act sick, up it to maybe twice a day. It's a gold standard in our family. We love it. All right, let's move on to something else. Virusid has been a mainstay in the practice. This is a product by Orthomolecular. I've loved it for a long time. It's great for fighting infection and fighting viruses or decreasing that viral load. You can take 1 a day. And then again, if you start to feel sick, up it to 3 times a day. Let's go through the ingredients. It has vitamin A, vitamin C. How much have we been talking about these antioxidants when it comes to decreasing viral loads and fighting infections? It has zinc in it as well. And then it has astragalus, which is one of my favorite herbs, but has a couple of others too. But what I did is, because I was convinced that we can all get rid of COVID-19 by putting together a protocol of immune support, I put together this product. This is the Defender, and I am so proud of it. It's an Anger product, I keep saying, but essentially it's vitamin C. You've got a gram of vitamin C in here. You've got zinc and you've got astragalus all put together. You can take 1 to 2 a day if you're healthy, but the minute you feel bad and start to get symptoms of any kind, increase it to 3 times a day. Your kids older than 5 can take this. They can take 1 a day. But again, if they start to feel sick, you can increase that as well. Sort of related to that, the Defender will have a cousin of the Defender, which is the Defender Plus. It is going to have a key ingredient that is normally in UMCA. It's going to have geranium, it's Pelargonium psilocydes, which is basically from geranium, and that helps to thin down respiratory secretions. But for those of you asking what you like to give your kids, if your kids are starting to, this is if they're showing signs and symptoms. Some of these other ones are more for prevention, but if they're showing signs and symptoms, think about giving them a teaspoon of UMCA 3 times a day. And then when the Defender Plus comes out, we can use that as well. All right, one more thing to show you in my immune bag is the Belly Fix, right? Named after my book from 2014. This is for kids or for adults. Gut health is almost 75 to 80% of your immune system. This has, I'm going to read off the ingredients in here. Of course, I should have it memorized, but when I'm speaking, I often flub. But it has MCT, medium chain triglycerides, which remember help to stabilize gut bacteria. It has fermented probiotics and prebiotics. It has collagen to rebuild that gut lining. It has turmeric in it as well. It has glutamine and it has spirulina. And that concoction, or that blend in particular, is going to help with inflammation. It's going to help repair and rebuild leaky gut, and it's going to help protect your immune system, because remember, the gut is a foundational component of your immune system. So that's what's in my little immune bag. You should have sort of the stuff ready to go, armed by you, as we head back to school and back to work, and hopefully into more of a regular routine or regular schedule, keeping this stuff on hand. And right now it's a routine in our house. Everyone takes the Defender every morning. The kids take the Ion Biome. I take the Defender and the Belly Fix and make my husband do the same. And then we take some of the other things that we normally do for our health. But that's just a mainstay of what we do right now to help keep our immune systems primed and ready to go. And then, okay, let me take a couple of questions. I'm getting this. Can you write all this down and outline all these items? I have a 3-year-old jumping all over me. What, you can't focus just because you have a 3-year-old on you? Of course I can write them down. I'll write them all down. I'll probably respond to your comment, Holly, and that's probably the best way for you to find it. Someone's asking if Belly Fix is okay for kids. Yes, it is. So the serving size, let me open this up and show this to you. I actually really like the smell. So it has almost like a, what's the best way to describe it? Like there is turmeric in it, but it has like a little bit of a cinnamony smell, but that's what it looks like. A full scoop is for the adults. For the children, you can do about a half scoop. Okay. So, and you mix it in. For kiddos, you can mix it in some juice. You can mix it in some warm water and add some honey to it and make it like a blend tea. It does turn green. So if they're going to be afraid of the green color, then mix it in a little bit of juice and that should take care of that. So Belly Fix you can use for kids and you can use for teenagers as well. For teenagers, a full scoop. Once you get to adult weight on this stuff, like once you're above 90 pounds or so, you can do the adult dosing on a lot of these different things. Okay, someone's asking, are those safe for food allergies? My son has tree nut, sesame, and fish out. Yes, there's no fish and there's no tree nuts in any of the stuff. So yes, it will be safe with food allergies as well. So give it a try. And when you guys try the stuff, let me know what you think. Let me know if you think it's working. Maybe write a review, post a review online. But these are all, for at least the ones on the East-West line, which is my line. These are formulas I've thought through after patient experience and really dealing with patients and seeing what's missing. And then the other ones that we mentioned are things that we just know from clinical experience that they work. They absolutely work. Someone's asking me, these are on the Dr. Taz site, but they're actually moving over to the East-West site, which will be launching, I think, tomorrow. And then they're also on the Center Spring MD site. So those are the two websites, and I can write those websites down for you as well. So those are some of the things I like there. Let's see if there are any other questions. Do you guys have any other questions that new hospital admissions? Let's see. There's not so much a question. I had a question about teachers. So there are two questions. There are multiple questions about teachers, faculty, and staff. And I think somebody here on Facebook, let me find that question as well. Somebody commented, I have several teacher friends who do not want the schools to reopen until it's safer for them and the students. So we totally understand that our teachers are concerned, but I think it's the same thing. The teachers need to understand that the greatest risk is a big group of adults congregating, not kid to teacher or not kid to adult or kid to kid. So I think teachers need some guidance and reassurance too, that if they're doing the things to protect themselves, again, washing their hands, wearing a mask, protecting their immune systems, watching what they're eating, taking some of these things to help make sure their immune systems kind of are ready to go and ready to fight, then I think they're going to be okay too. It's sort of the same conversation. I don't think we're in a position to hide from this virus, and this virus is weakening. It is not necessarily a death sentence for everybody. So please keep that in mind. And I totally am sensitive to how teachers may feel about that. As well. Is the death rate still low with COVID-19 across the US? So I meant to go over numbers and I didn't, and I apologize. So the last, the last numbers I could pull, the overall cumulative COVID-19 hospitalization rate is 107 per 100,000 with the highest rates in people 65 years of age or older. So again, those are your most vulnerable folks. And then the next at-risk group are folks 50 to 64 years of age. So that's where we are. So I think the hospitalization rate is overall stabilizing. The death rate for the US is roughly 2%. So that's rough. It's very much in line with the flu. So it's very comparable to the flu. And there's some concern that COVID, again, because it's being caused by one or two because the scary part of COVID is when there are multiple other medical conditions that oftentimes COVID is listed as the cause of death, whereas in reality, some of the other conditions were actually the issue. So we've been hearing a lot about that as well. Again, there's no data on that, so we don't want to spread rumors, but that's just something that there's a concern too. All right, let's see. We're getting a lot of questions coming in. Let me continue to scroll through them. We talked about the food allergies. Yes, we're going to write all this down. All right, someone's asking, if your college daughter takes zinc, D3, and C, can she also take the Defender and the Belly Fix? The Belly Fix for sure, that's not going to interact. There are none of those ingredients in the Belly Fix. She can still take the Defender. You just have to watch her total zinc to make sure her total zinc intake is not going above about 30 milligrams per day. Sometimes that can be a little bit too much zinc. So I would just take a look at that. All right, let's see if there's anything else. Let's see. I don't see anything else on here that we need to comment to. A lot of other, how long will it take to get my immune, oh yes, sorry, we need to answer that. How long will it take to get my immune system strong enough to fight COVID and other sicknesses? How long will it take? So I would say a consistent plan of at least 3 to 4 weeks is typically what's needed to help you sort of build your immune system and decrease inflammation. It's exactly what I tell patients in practice, is that you want to be very consistent for that period of time. And that's really kind of at that 3-week mark or that 4-week mark, you start to notice your entire health shifts. Now, having said that, I'm thinking more about a health overall, but every tiny change you make makes a really big difference. So keep that in mind too. All right, let's see. I don't think I missed any other questions. Okay, we talked about the immune system. How long does it take to build up? That was a common question for you guys. About 3 to 4 weeks is probably a total time, but everything you do ultimately matters. For the inappropriate comments on here, we're going to block those. I don't know where those are coming from, but I'm going to go ahead and block some of the stuff. So get rid of that and we'll block that. Okay, and then let's see. How much zinc should you take? Zinc is the amount of zinc for an adult is about 15 milligrams a day. You can go as high as 30 or even 40, but 15 is about the average. So 15 milligrams a day is the amount of zinc to take daily. Lots of great questions, guys. All right, let's see if we have any other questions that I can answer. I think, is astragalus safe to take? I apologize. If you have cancer, such a great question. So it depends. Astragalus is safe to take absolutely if you have cancer. In fact, we include it in some of our cancer protocols. However, you have to look at astragalus and its effect when you're on certain chemotherapy drugs. So that's why I can't answer that. I have to know more about the treatment that you're on and what you're doing, because there is concern with certain chemotherapy drugs, certain herbs don't work well together. All right, Holly, you have a question on kiddos wearing masks all day. Yeah, it's not ideal, right? It's not fun for them. And I actually feel for them. I feel for all the kids going through this pandemic. And it's definitely something they're going to carry with them as they go through life. But I think it is not ideal, but it's still better to get them in school and get them learning and get them in an environment where they're thriving and able to interact with each other. I think that's important too. So I think it's going to be hard on them, but I think it's one of those sacrifices that we are all going to have to make, and they're going to have to understand that they're going to have to do it too. And hopefully we can just get through 2020 and maybe put this all behind us. All right, one more question about the Belly Fix. Does the Belly Fix work if you're on antibiotics? Great question. It will work. But again, instead of like maybe taking you up here, it's going to take you there, because antibiotics, remember, are wearing away at your microbiome. They're eating up your gut lining to a certain extent, but if they're needed, they're needed. So what I would do is take your antibiotics and maybe 3 to 4 hours later, take the Belly Fix, or have at least a 3 to 4 hour separation between Belly Fix and your antibiotics. And hopefully that would be helpful and sort of repairing the gut while you're on antibiotics as well. So much similar to the advice that we give when we talk about taking probiotics and antibiotics, right? We don't want to take them at the exact same time. We usually give it about a 4-hour separation to allow each to work appropriately. All right, so that is a lot of information. We're at 9:32. I'm sure you guys have places to be and things to do, like your bed, maybe, hopefully. But we'll close with another quote and maybe even a prayer, because I'm always thinking of all of you and all of us and hoping that we're going to come together and fight through this thing and move ourselves forward and onwards and upwards. This is a quote: "We are here to awaken from our illusion of separateness." And I think that's true with medicine. I think it's true of people. I think it's true of race. I think our ultimate goal is for all of us to be united, to bring everything together, to view health holistically as well, and to really view each other as so essential to our collective healing. So that's why getting our kids back in school, getting our country and our world reopened is not about being selfish, but it's about all of us observing the right precautions so that we can go back to maybe the way things were, but even better, with more appreciation, more understanding, and more respect for one another. And for our children, well, they were calling them entitled for a really long time. And this is an experience for them to understand what sacrifice looks like and how things can change in a moment's notice, and to never take anything for granted. So I'll leave you with those thoughts and wish a great week ahead for all of you. Stay healthy, stay well, stay superpowered, and I'll talk to you guys soon. Remember to continue to leave me questions. I'm happy to answer them. DM me. You can text me too if you're on Instagram, and we'll continue this conversation. If you need more of these, let me know that as well. Take care.